started. We know folks will still be joining over the next few minutes, so welcome everyone today. This is our monthly webinar series on network leadership, lessons from the field. I am Danielle Varda, the director from the Center on Network Science at the University of Colorado, Denver in the School of Public Affairs. What we do every month at the start of this webinar is just give a couple minutes of background on why we do this series and what it's all about. And so I'm going to go through a little bit of that just for a couple minutes here, and then we're going to get right into our presentation today, which is a little bit of an unusual one because I'm part of the team presenting. I know most folks know that I do the facilitation of the beginning and the end. So I have the privilege today to be presenting with Malcolm Williams from RAND Corporation, and we will explain that in just a moment. So just to get a little bit of background on what this series is about, it's hosted by the Center on Network Science. We are a team of folks who help communities map out their assets, their connections. We try to help communities find where they have gaps in those assets and relationships using tools and technology, and work with those same communities on trying to fill those gaps by taking collaborative approaches and leveraging resources and partnerships together. Two of the tools that we use to do that are, one is the partner tool, which a lot of folks might be familiar with. Today actually is a webinar where we're going to get to talk a little bit more about it than we usually do. It's a practitioner designed network analysis tool. It has a survey analysis and visualization feature. Check it out if you're interested. And the other tool is the person-centered network app that allows folks to collect data at the personal network level, really looking at things like social support systems. The app is designed to assess a personal support network and then link to resources in the community. So another thing, it's actually just launching in the next month or so. So two of the tools and resources that come out of the center. So what is network leadership? Why do we do this series? Network leadership is a model to help people who are part of cross-sector community efforts learn how to build, manage, and evaluate effective networks. We believe lots of people need help in building these skills, and so as part of that capacity building approach, we do webinars like this in order to kind of help people see what others are doing. Typically it's a practitioner presenting, and learn from them. We do have an annual Network Leadership Training Academy that will come up in April. Our early registration deadline is Friday, and it's pretty certain it's going to fill up by this week or next. So if folks are still interested in that, make sure that you get on or learn more about it. We are talking now about doing possibly some NLPA light versions in the fall for a lot of people who are asking for the training and to come together as groups of network leaders at different times of the year. And just one last thing on network leadership. Network leadership is not a set of 5 things that everybody has to follow to lead and manage your networks. Rather, network leadership is based on a set of values. They are that it's inclusive. We believe everybody who is involved in the network way of working needs to build network leadership skills. It's community and culturally sensitive in that we believe every community is different, and so we don't give anyone a prescriptive set of things they need to do, but help them think about how to build the skills that they need to do that work. We also believe that it needs to be data-driven, that even though relationships are intuitive, the way that we manage them is not, and so we try to help people get data in order to do that work, reflect on it, and then adapt their leadership styles, the way they manage their networks based on the data that they got. And this I'm going to show today, and I never show this at the beginning of a network leadership webinar series, but given our topic today, I thought I would do a real networky slide for a moment. And so this is really an example of what we're going to talk about today, though in more depth through an example of the Million Hearts work that CDC is doing. But this map right here, we see if you look in the center and see the nodes and lines, the squares and circles, they don't move in any of the 4 pictures that surround them. The reason that we show this map is to kind of show how networks tend to evolve and why network leadership might make a difference. So in the top left corner, that's typically how a network of organizational partners might come together. They've gotten funding, let's say, from someone. They build some kind of network, invite everyone to a meeting, and list who's not already connected. If you move to the top right corner, you'll see that that's kind of the next step. People typically move into the work of inviting those who are not already a member. In the bottom left corner is what tends to happen next, which is increasing density, inviting as many people as possible, getting them to participate as often as possible, and reporting back to our funders and our stakeholders and partners that we have built a really robust, frequently interacting network. The problem is networks stay there forever, and we really don't have a good way for people to understand their roles. There's usually very little strategy for how we're using people's time. And what we know about sustainability of networks over time is that when people have an identified role, when they are being asked to serve in their most valuable way, the fewest number of times possible, we can maintain robust networks that may be able to sustain for the course that they are needed. So in the bottom right corner is an example of implementing network leadership, an approach to building your network that asks people to come less often, identifies when they should come, what they should be doing. In this case, maybe there's a set of work groups and a core group that meet more infrequently. So this is usually how things kind of evolve. And given what we're talking about today, it's really one way that we wanted to kind of set the stage for why you might want data. It's really hard to move through these parts of building and managing your network if you don't have data to really understand how to do that work. So with that, we're going to kind of get started. As a reminder, you can stay connected. We always recommend using the hashtag network leader for any of the work that you're doing around network leadership. Here's some other ways. We have a network leadership group on Facebook to stay connected with. And today, I've never introduced myself in this way, but today it'll be myself and Malcolm Williams presenting on this work. I've already said who I was, and I'm really, really pleased to introduce my colleague, Malcolm, who is a senior policy researcher at the RAND Corporation and the Associate Director of Behavioral and Policy Sciences Department. Just a fantastic researcher. We've actually had the privilege to know each other for quite a long time, as we both started at RAND around the same time and now are still getting to continue that work in ways which we'll talk about today. I'm going to turn it over to Malcolm. The only last thing I'm going to say is, as a reminder, we take questions in the Q&A section of the webinar. So if you are having a technical problem, make sure that you put that in the chat box. If you have a question that you want to queue up, write it in the Q&A box, and we'll have time at the end of this to go through questions and answers. And actually, one last thing I did want to say is on this webinar, I wanted to explain who is on the webinar. So you can see in your participant link how many people are joined up, but the folks who join this webinar are from all kinds of different sectors. We do have a good number of folks from the Centers for Disease Control on the call today because it is part of a project that we've been working on with them. But in addition, we have folks from all over the country working from education, public health to public safety on the call. And so we're really trying to open this up and this kind of work as an example of a really unique and robust network that the CDC has been a part of for a number of years now. So Malcolm, with that, if it's all right, I'm going to turn it over to you.
Thanks, Danielle. Again, it's been a pleasure working with you on this project, and a really interesting project to work on overall, trying to understand various aspects of the Million Hearts Network. I just want to highlight that this work was funded by the Office of the Assistant Secretary of Planning and Evaluation and at the U.S. Department of Health and Human Services. And Million Hearts itself is sponsored and led by the U.S. Centers for Disease Control and Prevention and the Centers for Medicare and Medicaid Services. Can you advance to the next slide, Danielle? So I wanted to provide a high-level overview of what we were trying to accomplish in this project. And then Danielle's going to talk a little bit more about some of the social network findings specifically. And then we'll talk about what we think are some of the facilitators and barriers of the outcomes of the project, as well as some suggestions that Million Hearts leadership could consider for next steps as they move into the future of the project, but also I think of them as suggestions for any network considering how to use data like this. This research was really designed to paint a picture of what the Million Hearts Network looks like, identify how partners interact to implement the cardiovascular disease prevention activities that they're interested in working on, and document the activities that they're engaged in. Because we're looking backwards at the impact of this initiative, it was also important to our sponsors to try to assess how partners shape their cardiovascular disease prevention activities with respect to Million Hearts. So, for example, how did they change what they did in terms of programs or policies, or even the way that they interact with partners after getting integrated into Million Hearts? There's clearly been a lot of potentially positive Million Hearts activities out there, and as a result, we wanted to try to define what those facilitators and barriers were. Because it's a network, we also wanted to focus on the facilitators and barriers to actually coordinating activities with each other, not just achieving the goals of the outcome. And then finally, we wanted to try to conceptualize this information in a way that's helpful for the future. We took a couple of different approaches that I'll talk about in just a minute, but across all of those approaches in the work of this project, we relied on the input of a technical working group of experts most closely associated with the leadership of Million Hearts. Their information was integral for the entire process. They offered direct assistance in identifying partners for us to seek information from, and we solicited feedback from them, as well as reviewing and helping us conceptualize our results. So I'll talk about the methods now on the next slide. As I said, we had a few different methods. The first was an environmental scan. I just want to briefly touch on these today, actually, because I think the focus really should be on the findings and what those facilitators and barriers were. But I just wanted to give you all a sense of what we did to get to those findings. If you have questions about a specific method, I'm happy to answer those at the end of the presentation. So as I said, there were 3 specific methods drove our approach. The first was this environmental scan. We thought of it as a high-level look at the stakeholders at all levels of Million Hearts, how they're connected, what's their understanding of how they're engaged in community-level activities in order to address the goals of Million Hearts. And it helps us answer some of the project's key questions, like how are Million Hearts activities translated at the local level? How are partners connected at the national level? What activities are taking place? For that, we reviewed a total of 74 documents from the peer-reviewed and gray literature, as well as specific partner websites. We focused on the time period of 2011 to 2016, and the findings helped define our approach for both the interviews and the social network analysis. The qualitative analysis allowed us to learn about Million Hearts in a more in-depth way by talking to those that were most closely associated with it. So we generated a list of participants for that qualitative analysis from the environmental scan, as well as the national lists of organizations that were involved in Million Hearts, and then those that had the greatest contact with the technical working group. In consultation with the technical working group, those who had the most contact with Million Hearts. We focused both on organizations that were central to Million Hearts in terms of their level of activities in Million Hearts work, and those that were at the periphery, to try to get a sense of Million Hearts from the organizations that are participating and those that had the potential to participate but weren't. And we think it adds depth of information to what we found in the environmental scan. And ultimately it helped us bound the social network. The social network analysis we did with 58 organizations. Danielle's going to go into that in more depth in a minute. I'll just say that the emphasis was in this case was in clarifying how partners interact, how strongly they're connected to one another, and how the partnership is organized. I'll move on to the next slide and talk a little bit about the way that the goals and activities of the organizations that have been involved in Million Hearts. The scan identified through those documents a set of about 74 unique partnerships and activities. We found that about 52 of those involved a state level partner, 44 involved a local partner, and the most frequently observed partnerships only involved state or local partners. So very much Million Hearts is a local and state activity. The focus of those partnerships was consistently on 4 goals that they identified in the documents that we were reviewing. The first of these was increasing awareness about the ABCs, hypertension, cardiovascular disease, and other Million Hearts foci, implementing and reporting measures and practices on cardiovascular disease prevention activities, training medical care providers on the screening and prevention of cardiovascular disease and hypertension, and then also increasing the use of tools that are aligned with Million Hearts. The national partnership has a unique and specific composition that supports the activities at the local level. And what we also found was that the goals that we identified at the local level were really most often identified in the interviews that we conducted and the social network analysis that we conducted. The way that the national organizations support local activities is through developing tools and resources to share with Million Hearts partners. One of the most frequently activities mentioned among the non-governmental organizations that were participating in Million Hearts was conducting public education activities and health fairs. Some convened meetings or conducted trainings. And then some of the other national partners also implemented new cardiovascular disease prevention programs, including disseminating information and tools for engaging in advocacy. We also found that some of the national activities that were disseminated to local communities or for local use were training, technical assistance, the implementation of new cardiovascular disease standards of care and practice through guidelines and other information. And then less often we found that partners were engaged in research or funding cardiovascular disease research programs. So at this point, I want to turn it over to Danielle to talk a little bit more about the social network findings of the organizations that participate in Million Hearts, and then we'll come back later talk about some of the outcomes that were observed and the facilitators and barriers of those outcomes in the partnerships.
Okay, thanks, Malcolm. So Malcolm has set the stage of what was a really big effort to really try to understand this very unique network. Some of the things that made it really unique was that it is at the national level, and meaning that its members are all over and part of both federal and private and public sector agencies. And so it was a really unique setting and effort by the federal government to convene a network like this. It's one we don't see very often. I wanted to show this kind of picture and explain what the partner tool was a little bit, because on almost every call when folks ask about it, we never really get to say much about it, but we did use the partner tool. So what we did is we modified the survey that is in it. The survey allows us to ask questions from people about the kinds of resources they contribute, the kinds of outcomes that they are observing happening, the ways in which they interact together. We ask them to report their perceptions of one another on things like trust and value, and I will explain that in the finding. And we also ask other questions like Malcolm mentioned, like facilitators and barriers and things like that. The survey's been used in over 2,000 communities, so this would be 1 out of 2,000. It contains information on 100,000 or more organizations and relationships between them. And I mentioned that because this project is also unique in that we used that data set in order to cut the data by certain characteristics, which I'll explain in a moment, to look at the Million Hearts Network as it relates to other networks, which really gave us a lot of context for the ways in which we could interpret this network. So we gave the survey out and had 58 folks respond to it, and were able to come up with some findings of the composition of the Million Hearts Network. And just on this note, this is a very basic network analysis. It's descriptive. We primarily focused on some of the structural characteristics. What we're trying to demonstrate, particularly in this webinar, because it's part of a network leadership webinar and skills-based, is how you might collect these kind of data and how you might use them to think about what you might use as recommendations and suggestions. So what we know about Million Hearts is that it is a diverse, decentralized network with low density. So let me break that down a little bit. You'll see in the top row the types of partners that are a part of this, and it ranges from federal folks like public health research organizations, private professional associations, other type of private organizations, and some other categories as federal organizations. So it is pretty diverse. It's not just made up of federal partners. It's really looking across the sectors. The density score here is a measure of all of the connections that are reported in the survey compared to those that could have been reported. So 100% would mean everyone is connected to everyone. So what you'll see here is that the Million Hearts Network has a very low density score. So the way we like to look at that from a network leadership perspective is that there is a lot of opportunity here to develop more connections among partners. What's really interesting is that our response rate was rather high on this network, and because so we can't really say that the low density score is because we didn't have enough people respond to the survey. We had enough people to respond to know that the number of interactions between partners is actually somewhat low. It's also a decentralized network, meaning that there is no clear hub. We had expected maybe that CDC or CMS might be, as facilitators of the network, kind of the hubs of the network, but we don't really see that. We see that there are many organizations that are connected to many others. And so even those that have the most connections have connections to different people in the network. So what that means is that it's really a well-connected network, but not because everyone's connected to everyone else very frequently. It's a really unique structure. It has its pros and its cons, and we can kind of talk about that. But one thing we know for sure is that we have a lot of information now on ways that we can think about how we might move forward with this network, what we might do next. What we also learned about Million Hearts was a little bit about the type of interaction and the resources. What I'm calling out here are some of the more interesting findings. The type of interaction that most people reported, around 75%, was that their interaction was information sharing in nature. And then it dropped off by a whole bunch, meaning that not a lot of folks are doing a lot of other things. There are areas of partnerships in this network where other work is going on that actually require more resources. So it's a real low kind of resource intensity when you do have an information sharing network. This matches the goals of Million Hearts. The goal of Million Hearts was to create this information sharing network, disseminate this information, and get it out to the local level. So by saying this is by no means negative. It's quite positive that it is a real strength that they've met this goal. And so they're at a place now where we're thinking, what is next? Is there an appropriate next, or have we met those goals? In terms of resources, this network is pretty unique because it is resource rich. When we ask members of the network what kinds of resources they can contribute to the work, the number of resources that people offered on average is far greater than in other types of networks. And some of the really interesting parts about that is some of the unique types of resources that were mentioned were things like facilitation and leadership. Those are things that in networks that are not at the national level are not normally offered. So this network has a set of partners that are particularly interested in facilitation and leadership of that network and of the work that's happening. That's a big strength, and one way to leverage, if there are next steps in the network, how we would leverage some of the network members to take that step and not necessarily have to rely on one or two organizations to do that work. A really important thing to think about when you don't have a lot of resources or an infusion of funding coming in to pay for that work, it's kind of leveraging the things that people in the network can already offer. We also measured trust and value, and what I mean by that is we asked all the members of the network to rate their partnerships among one another on these dimensions. So trust is measured on a scale of 3 things. I just realized that in the slide these are backwards, so my apologies. Trust should be over the trust and value should be switched there. So trust is actually measured on reliability of partners, mission congruence, and open to discussion. And we use those based on a lot of research on how we developed that scale. And when we developed that scale, we asked a lot of people, how do you trust one another in this kind of work? And people said, we find people reliable, we know that we have mission congruence, and we can talk together about some of these issues and hard issues. And then in terms of value, we know that folks value one another in terms of the power and influence that folks bring to the work, their level of involvement in the work, and their resource contribution in the work. And so these dimensions have been used across thousands of networks to measure perceptions of one another. And one thing I always like to say is that some people might wonder, why do you measure perceptions? And I do like to say that in a network, the relationship that any two members have of one another is really their perception. So my perception of you and your perception of me is our real relationship. So being able to measure that and capture that and know that about members of your network is a very powerful thing in network leadership when you are trying to think about how are we going to leverage, manage, and really facilitate and nurture ties. What you'll see in the Million Hearts Network is that the line right there is drawn at the 3. 3 means that on average, people reflected about each other, that they were at least a fair amount to a great deal in each of these categories. So you'll see that there's a great deal of trust in the Million Hearts Network, and the perceptions of value of one another are also very high. The only value perception that did fall even barely under 3 was on resource contribution. And so what that meant was that there was some perceptions of one another that there wasn't as much resource contribution from the partners as they might have expected. It's a really interesting finding when I just said that that the members reported that they have a lot of resources that they would like to contribute to the work. And then we learned that they have a perception of one another that they are not contributing as many resources as perhaps they could. It's a really particular poignant point that we can think about in terms of how to leverage what people are saying they'd like to contribute and maybe what they already are contributing. So we really thought that was an interesting part of this. So the last thing I was going to mention in the analysis was this thing I mentioned earlier was about the comparison data. So really unique to this project and really prompted by the really smart people who designed this project before we were ever a part of it was some thinking about how to compare the network to other networks. So we know that networks at the community level are very different, and it's very hard to compare one to the other. And if you've heard me talk before, you're probably going to say, Danielle always says, don't compare one network to another. When you're comparing networks on performance and what's their best network, it's very difficult to do that because we know, different communities have different goals for what they want to achieve with their network work. However, using this large database and cutting it in these 3 ways, we're not comparing one network to another. We're really comparing the Million Hearts Network to trends in other networks that we're seeing across large groups. So what we did is we identified 533 public health related networks in the database. And although that's a huge number for whole networks, we really were trying to be really specific on the comparison so that they made more sense. So what we did is we narrowed it down to 46 networks whose focus was on chronic disease prevention, a similar area to the work that Million Hearts partners are doing. We also narrowed it to 18 networks of similar size, and the size here was between 60 and 70 network members. We did that because we know that size matters in networks. The way these scores play out has a lot to do with the size of the network and the response rate and the way that folks talk about those interactions. Then we also wanted to look at it at the national level. So we found 2 other networks that were designed in the same way that Million Hearts is with national level partners. That's how unique the Million Hearts Network is that most networks don't function at that level. Most of them, at least most of them that are using this tool to measure, are at the community, regional, or state level. So this is a really unique effort that CDC has undertaken. So we were able to compare it to 2 others, though, that are similar to that. Okay, so on this slide, you see a lot of little dots as a lot of network graphs go, but what you'll see here is at the very top, each color signifies one of those groups. So the orange dots show the chronic disease prevention networks and their average scores. The blue dots show the similarly sized networks. The yellow dots will show the national networks, and the green dot shows the Million Hearts network. And so what we looked here is across overall scores. So we translated the trust and value scores into whole network scores, and we plotted those. And so, for example, you'll see that across these networks, they fall kind of on the higher end of trust and value. That's not that unusual. A lot of folks who work in these community networks and these kinds of interorganizational networks do value and trust one another. That's why they're doing the work. But we do measure it nonetheless. And what you'll see here, like for example, on trust, is that similarly sized networks as Million Hearts had around a 60% trust score, where the Million Hearts network was more in the 70s. You'll see the chronic disease prevention networks were on average higher scores of trust. So that's how we're reading that map. I was just reading the first row, or this chart. So if we go, we see some very similar thing around value, but response rate was very interesting. You'll see that the Million Hearts Network had a really high response rate in comparison to others. Response rate matters because the ways in which people respond to these surveys tells us a lot about how much buy-in they have to the work and the measurement. And we do think of it as an indicator of how well that network is getting its, folks in it to participate in the work. What you will see there, though, is that the other two national networks actually had almost a 100% response rate. So there was a little bit more connection and buy-in of those other national networks around doing the survey. What you'll see on network density, this is where you'll see that Million Hearts fell really on the lower scale, but not that different from other similarly sized networks. Density has so much to do with how many partners are in the network that makes a lot of sense. The only thing that makes it the comparison really interesting is that if you look at the national networks, the yellow node on that line, you'll see that their density was actually much higher, and they are similarly sized, and they have actually a lot more interaction. And so that was an interesting point of comparison for us, that other networks, we could almost say that the national network is harder to get everyone to interact with, except these other national networks are actually doing work that is a lot more frequent and many more types of interaction. So it's been an interesting thing to compare. And finally, the last one I'll just talk about is centralization. And we do see that the Million Hearts Network is rather decentralized. As the little dots go up the scale, we see it as more and more centralized, meaning that it's more and more, all structured around a single or just a couple set of organizations. So like you'll see there, the other national networks are very centralized around one or two organizations. So this is a really interesting, unique feature of the Million Hearts Network, that it is rather decentralized, and we're trying to think of a lot of questions to kind of figure that out. So I'm going to end there and give it back to Malcolm to spend a few minutes on Million Hearts achievements and barriers and facilitators.
Thanks, Danielle. So one of the things, one way to think about achievements is to think about the outcomes that the documents in the environmental scan highlighted, and to hear directly from the participants of Million Hearts what they think were some of the major accomplishments. So in terms of the environmental scan, and this isn't on the slide, but I just wanted to point out that the scan identified several outcomes that have been achieved. The first is controlling hypertension and blood pressure, improving processes of care, and improving cardiovascular disease health knowledge. Those are the specific outcomes that we identified in the documents that Million Hearts partners wrote about their own partnerships. They're not externally evaluated outcomes, but just those mentioned as having been achieved. When we talked to the participants of the qualitative interviews, they agreed that Million Hearts has achieved those improvements in clinical screening and cardiovascular disease treatment, and that it has helped establish standards of measurement and clinical practice, and that it's increased cardiovascular disease awareness. The social network analysis respondents added on the survey that Million Hearts has focused clinical attention on the prevention of heart attack and stroke, and improved quality of care for heart health. A primary benefit across both the qualitative interviews, though, and the social network analysis was the identification of the development and growth of partnerships designed to address cardiovascular disease prevention, which they thought was particularly important for the work that they did. So from our perspective, the benefits and the outcomes of Million Hearts can be measured by what the individual partnerships achieve in terms of cardiovascular disease outcomes and cardiovascular disease prevention outcomes, and as well as the interactions among partners within the network. And on that perspective, we learned a lot. The first is that some of the other benefits that we found included this establishment of a sense of a greater community and trust among organizations that were working together to address cardiovascular disease prevention. Another was bringing together multiple partners across the country to address this disease in the United States, and that, and of course, that cardiovascular disease outcomes achievements were attributed to the relationships within Million Hearts. The new relationships that were developed across sectors was also mentioned as being particularly important for the reduction of cardiovascular disease risk. And then the creation of new and enduring communities of practice with a common sense of purpose and trust was mentioned by participants. One in particular put it this way, saying that Million Hearts has brought a lot of organizations together that don't always talk, so that the physicians and the nurse practitioners and dietitians and whoever else are all at the same table talking about how they can reach each other, impact heart health, and no one health profession owns it. So overall, respondents had a very high level of enthusiasm for Million Hearts efforts to date, and for the continuation of Million Hearts. Many responded enthusiastically about the new connections that they made, deepening older connections, and then amplifying and broadening the impact that they could have on cardiovascular disease risk reduction through these relationships and the development of these communities of practice. In particular, they enjoyed the leadership style, which flattens, from their perspective, the playing field and downplays a potential hierarchy that can develop between different types of organizations that participate in Million Hearts. And they thought that the competition and publicly recognizing both the outstanding Million Hearts efforts and smaller contributions across the country helps motivate Million Hearts partners to stay involved with that work. So I'll move on to the next slide and talk a little bit about what we learned were the facilitators and barriers to these, to both the relationships that develop for Million Hearts, and then the facilitators and barriers to the achievement of Million Hearts outcomes. In terms of the activities, what we learned was that leadership buy-in within the organization was one of the things, as one participant put it, that could make or break Million Hearts partnerships. It's the thing that keeps organizations participating and organized around a set of activities. The diverse partner sets that occur within Million Hearts was found to be an important facilitator to activities, and the capacity within partnerships when they were successful to leverage the unique resources of all the members within their smaller networks was a way that they were able to help achieve their goals. And of course, having funding always helps organizations stay engaged. On the other side, in terms of keeping and coordinating efforts in Million Hearts, the alignment of goals between participating organizations and the goals of Million Hearts was critical. Having good communication among partners about what they were doing, the successes that they were having, and problems that were occurring was critical. Trust, and as we saw through the social network analysis, the high level of trust among Million Hearts partners is important for coordinating activities. And then one thing that was mentioned several times was that the official branding of Million Hearts, from their perspective, provides legitimacy to not only their work, but their capacity to be engaged with a national sort of momentum towards cardiovascular disease prevention, help them organize their work. On the other side of the coin are barriers, and in some cases, if we could just advance to the barrier slide, these are in some cases the other side of the coin of the facilitators, but also I think some sense that there are two sides, two ways to conceive of some of the facilitators and barriers too. So, for example, so some aspect of funding could be considered, necessary for engaging, but as we saw, some of the fact that it's decentralized and not all organizations are funding, I think from some organizations' perspective, provided a great deal of freedom for them to develop their own activities. Nevertheless, across research methods, the top barriers that we identified, including for implementing Million Hearts activities, including were a lack of funding, clarity on how Million Hearts is distinct from other existing strategies, and then I think in particular how to operationalize Million Hearts projects at the local level. So not just having information that is useful for developing cardiovascular disease prevention activities, but then step-by-step practices for actually integrating those into community work. The overall bureaucracy and the complexity of some of the clinical aspects of Million Hearts was also seen as a barrier to implementing activities. Barriers for coordinating efforts across partners included the competing priorities of partners, the difficulties of engaging, of bringing in the right stakeholders, and then stakeholders together in terms of time, geographic barriers, et cetera, made it difficult for coordination. The different perspectives of partners on how to address the same issue sometimes posed a barrier to being able to develop an approach that worked for everybody that was participating. And then the lack of resources to coordinate across stakeholder groups was mentioned as a critical barrier. So that leads us to trying to understand better what are some of the things that Million Hearts leadership in particular can think about for next steps. And then I think, as I said at the beginning, I think these suggestions are useful for other networks that are interested in thinking about how do you take this kind of data and use it for planning and refining your own approaches. So the first of these is that we heard that a lot that participants were particularly happy with a lot of elements of the approach of Million Hearts and wanted to keep those. But we also heard that there may be opportunities for leveraging more resources from the organizations that are participating. And at the one end of an approach to doing this would be simply developing ways to capture the resources and information and success stories from organizations that are participating in Million Hearts, and conveying that to the rest of the participants in a way that helps them organize and refine their own work. So, for example, this could include developing a comprehensive list of best practices among partners, and these could focus on specific activities in the community as well as activities for engaging partners. These kinds of activities could shift the balance away from information sharing and into the development of new specific activities. In addition to this, developing templates or forms that would make it easier for the partners to share what they're doing so that these could be summarized and disseminated among Million Hearts partners would be helpful. And in addition to that, constructing forums for sharing these success stories. So the development of the information is more complicated than creating a platform for those who have organized promising practices to share them. But we think both could be useful for potential next steps. The second suggestion that we had was for Million Hearts leadership to review the purpose of Million Hearts and consider whether it's at a stage now to reevaluate goals, approaches, learn from member expectations, and or to really think about whether changes to governance are necessary to achieve any new goals. So really it's about considering whether what's going on now is the way that they want to approach Million Hearts in the future. And if what they're doing now is sufficient to meet the future goals of Million Hearts. The barriers that we mentioned related to the challenges of coordinating partners in terms of priorities, perspectives, and coordination. And those are issues that could be clarified in this kind of activity. How specifically do those barriers arise, and what are ways that partners think that you could approach the reduction of those barriers? Across research methods, the partners that we talked to in Million Hearts identified that it's created opportunities for developing new relationships and deepening others. And this emphasis on relationship development was critical to the successes that they had observed in their own Million Hearts activities. So if deepening these ties is important to leadership, then steps to accomplish this include incentivizing relationships, and this can be done by sponsoring joint activities or conveying and communicating lessons learned, working on and supporting network strategies that can be used to deepen the relationships among partners could also be employed, some of which might require additional resources, and others might just require a more specific approach on developing those relationships. And then further, at the other end of the more complicated end of the spectrum of information gathering on practices, identifying and developing an evidence base using rigorously evaluation approaches can help identify what are the actual outcomes of specific types of practices in Million Hearts, and then using resources to disseminate those specific practices to other communities is something that Million Hearts can consider down the road. Third, in terms of suggestions, is the strengthening if we could move on to the third suggestion on the slides, strengthening partnership and engagement and increasing engagement and communications among partners. So as I was just saying, those are the strengthening the partnerships that that have developed is one of the things that the leadership can consider. And in particular, what we found was that diversifying the types of partners in Million Hearts could be important for moving forward. For example, increasing the involvement of private for-profit organizations and linking with more university partners could expand the resources that are available for Million Hearts and the types of activities that can be engaged in, including the potential to increase the evaluation capacity of those individual activities. Currently, we saw very little participation in Million Hearts from those types of partners. And then sponsoring face-to-face meetings, partners told us, or participants in our research methods told us, were much more effective for coordinating activities and should be emphasized in lieu of virtual forms of collaboration on specific types of activities among partners. Fourth, the development of diversified funding strategies to support Million Hearts work is one of the things that the leadership of Million Hearts could consider for addressing some of the other barriers and for looking for ways to integrate partners in new and different ways, as well as addressing the barriers that we previously identified. What we found that was working at a minimum was continue to emphasize and reward innovation at the clinical and community level, either by identifying best practices and communicating those, or looking for ways to support those more specifically. I think that leads us to the end of the session, and I think Danielle's going to facilitate a question and answer period for us.
Yeah, thank you, Malcolm. And so we just want to remind anyone that if you do have a question, to go ahead and use the little Q&A box to set it in there, and we'll have this last period of time to answer those questions. We do have a couple already, and so you'll have a minute or two to put any others in. And so, Malcolm, this can be for both of us, so whichever one works better. But so the first one, this first question is about recommendations for facilitating conversations with a network around resources available and sharing and leveraging them. This person asks, sometimes we find people are either competing for similar funding, audiences, activities, and may not be as open to sharing, or they may not even be aware of the resource or assets they possess that would be beneficial to others. So how you have that conversation with folks, and the Million Hearts is a good example when we had some thinking about resources. Malcolm, I can go ahead and take this one, and you can join in and let me know if you have anything to add to it.
Go ahead, Danielle. I'll add after you.
Okay, this is a really, really good question, and I think that what a lot of us might be familiar with in the world of public health are organizations that come together around a common goal and a common purpose. Other sectors, other fields have different contexts and settings where people come together maybe around a shared resource like water, where there's more contentious issues and more water rights, for example, or fracking, more of the environmental kinds of conversations where you do have a lot more tension and reasons why people might really want to hold on to what they have. So it's a really different conversation. The question is so good because it would be different in both of those ways. I mean, in the resource sharing question, when it's a context where it's not as easy to share resources, I always look to my good friend and my resource, Eleanor Ostrom, who talked about collective action and why people would work together in that way. But in terms of our area where we're talking about public health, I think the question posed was also very good in acknowledging that some people just might not understand the resources they have that can contribute to the work. And so what is important, and what we said a lot of over and over again, is that there's a piece of this that has to do with collecting data. And so collecting information about resources that people can contribute may sound pretty obvious, maybe even a little redundant to some of the things you might do when you put the network together, but understanding what those resources are and then trying to get a sense from people of how they are already exchanging it or not is the best way to have the conversation, I would say. So in this case with Million Hearts, we didn't really know that when we asked people very directly, what can you contribute to this Million Hearts work, so many of them would say facilitation and leadership. So in this idea of the suggestions that Malcolm just gave of moving forward, if they're going to rethink or if there's some conversation to be had around the strategies and the governance of the network, this is a resource that could possibly be leveraged. So the best way to probably do this is to let the membership know that they have a role in playing that and that it could be leveraged. And so I think there's a little bit of realizing, making the invisible visible for folks, and then getting them around the table in a collective way around thinking about how resources can be shared and letting people understand when they have a particular role that they can play in sharing those resources. Did you have anything to add, Malcolm?
I don't have a lot to add. I think, like you said, I think it's a really terrific question. It's not just in work like this, but it really cuts across sectors that people may not want to share their best practices because they're afraid that others can dip into the resources that they already have. I think it's true, and it's probably beyond the scope of what we're working on to be able to fully answer it. But in terms of this project, I think you're absolutely right that a part of what we were saying is that there are resources that are out there that are being volunteered, but there hasn't been a systematic effort to identify those resources and then leverage them for Million Hearts. So it's sort of learning what's available and then looking for ways to integrate that into the work of Million Hearts. Some of that might require resources which would keep those organizations specifically engaged, and I think reduce the risk that they won't want to participate. And I think it maybe adds food for thought for how do you engage stakeholders across the country that are interested in funding these activities. Funding is a really big issue, and when you do a project like this, I think sometimes the expectation is that the original sponsor has to take responsibility for every potential project that's out there. But on a national level, there are many partners that are interested in this work and are interested and have a funding capacity. So other government agencies, foundations, and so a part of what Million Hearts could consider doing is looking for ways to integrate those partners into the conversation about how to develop best practices and support them at the local level.
Good. Okay, so another question: what efforts have been made to bring the data findings back to the respondents of the survey? If applicable, can you describe the process?
I'll take that. This is actually the first effort to do that. Some of the participants, all of the participants of Million Hearts were invited to sit in on this session as a summary of what we've learned. We have briefed the technical working group, which is well connected to the overall Million Hearts partnership, about these findings before this presentation, and we are developing a set of documents and that we're gonna disseminate over the next couple of months. The work culminates in a final report that will be available through ASPE, RAND, and CDC. In development, we have a couple of journal articles, as well as potentially a research brief on the specific social network analysis findings that would be available on either the ASPE or CDC websites. And I know that in preparation, Million Hearts Leadership is thinking about how to take some of these basic documents and turn them into, I think, more accessible bits of information that the Million Hearts participants could use for their own work. So that's essentially the gamut of ways that we're going to communicate this back to that partnership.
But I just want to add, this is a really good question too, because we talked about how this is a unique network and then it's run at the national level and really by a federal agency. And that presents opportunities and boundaries around how we can share the data. Like, you'll notice that we didn't identify any organizations in the network. We don't actually identify organizations that participated and how they answered, even to the funders and the Million Hearts leadership. That's really intentional because we promised to be confidential in this work. And On the other side of that, and from a network leadership perspective, that's really limiting in a lot of ways, because we would hope that there would also, we don't hope, there are sometimes opportunities where we can work closely with the community, or the community, for example, might use the partner tool on their own and get their own data and use the information in a really visible way, really identifying who said what and who offered what, how they responded to the survey. And that ability allows you to really take it back to the community, involve them in the decision making, involve them in the process, even involve them in the interpretation of the results. And so if this were done in a different context, there is an opportunity to use data like this in a really participatory, community-based way. And what we did here is actually very interesting and unique, and an opportunity that very few networks get to go through at this level. But more of the networks who use partner, and I think the communities that are interested in measuring this, are really thinking about that. Like, not just how do you let respondents know, what did they answer, what was the survey, and what did it tell you, but involving them in the process, the iterative process of building and managing and adapting that network in new ways. And so using that data in that way is an option for other communities, and not as much in this setting. So I wanted to bring that up because in our center, we really, really encourage folks to take a community-based approach as much as possible, as much as the boundaries of that project will allow you to, and use it in that way. So we might just have time for one more question, so I'll just ask it real quick. Malcolm, this is really what we need to be asking the members of these networks, but what trends do you see in funding for collaborative networks? Are there ways to strengthen your funding proposals to stand out? Any tips for people looking to sustain their networks through funding?
Danielle, you might have some ideas. One place to consider is the Robert Wood Johnson Foundation has revamped its a part of its funding strategy, to focus on a culture of health. And one of the primary funding areas within that is developing multi-sectoral collaborations to address health. So I don't think that that foundation alone is going to support every potential collaboration out there, but becoming familiar with how they want to affect change on health and develop relationships among partners from in and outside of health could be a critical way for some partnerships to develop and seed their own work. And I think that kind of broad-based approach to developing and supporting partnerships increasingly is being taken up by foundations. The Aetna Foundation, for example, has just recently engaged in a couple-year effort to engage 50 communities or 50 partnerships in each state in the country in a challenge to develop healthier communities and cities. The purpose was to bring together, again, multi-sectoral collaborations of organizations interested in addressing health or having a health outcome of part of what they accomplish, seeding some work there, and then identifying a set of practices that could be disseminated more broadly through the identification of an overall winner of the challenge to continue their work, and other finalists that highlight specific promising practices. The Rockefeller Foundation has funded communities around community resilience, and so I think increasingly this recognition of the intersection of multiple sectors and multiple potential partners to address different kinds of outcomes is of interest to funders, and I think that will increase the opportunities for funding these kinds of projects. And then I think then there are others. It's in particular identifying for local funders how they could participate not just as a funder of the project, but as a key partner in developing the idea and the approach too, is a way to identify resources in local communities.
Malcolm, I'm just going to add one thing. We're at the top of the hour. I sit on a lot of committees of local foundations where I help to review grants for proposals. And in that capacity, I've learned a lot about how people describe their collaborations on a grant proposal. And the reason I sit on all of these committees is because almost every funder that I can think of is moving to a collaborative funding structure where they want to fund groups or projects that involve lots of partners. And so it's becoming more and more of a requirement in the RFP. And this is my one tip, is that most people will list their partners and how many partners they are, and they have an assumption that the more partners they list, somehow the more impressive that looks. And the review committee is immediately asking the question, are all these real partners? Do they all come together? Are they all part of decision making? And there's a little bit of suspicion that more is better. And in network science, that's kind of the big principle that we teach around, is that more is not always better. So my tip would be to think about describing the partnerships you have, the quality of them, the way you leverage them, the way you interact with them, rather than listing them as partners and how many meetings you have. So that would be my tip as a reviewer of lots of funding proposals for that. And with that, we are just at the top of the hour, so we just want to say thank you to everyone. It was a really big crowd today, and we appreciate everyone's interaction. And we are skipping April because of our Network Leadership Training Academy with these webinars, but we'll get back to them shortly after. And thank you, Malcolm, and thank you to the CDC and the ASPE and others for supporting our work and helping us put this forward today. So thank you to everyone. We appreciate you being here, and we hope that you have a great rest of the week. Bye-bye.